we are starting with anatomy of the upper limb, in which the first topic will be pectoral region. So just a brief intro about the pectoral region. So pectoral region contains the soft tissues that are present in the anterior chest wall. So the soft tissues in the anterior chest wall. So what are these soft tissues? These are the muscles, and one important structure that we study in pectoral region is the clavipectoral fascia. So these two are the main topics that we will be covering in the pectoral region. Now, coming to the muscles, what are the important muscles present in the pectoral region? There are three muscles. The first one, the most important one, is the pectoralis major. The second one is the pectoralis minor, and the third one is the subclavius. These are the three muscles that are present in the pectoral region. Out of these three, pectoralis major forms the bulk of the pectoral region. Hence, this is the most important and this is the most frequently asked question in your university examinations as well. So let us proceed with the pectoralis major and let us see its origin, insertion, nerve supply, action, and a little bit of clinical anatomy that you need to know about pectoralis major. So I'll start with pectoralis major. So this is a fan-shaped muscle. Okay, it has two heads. A clavicular head and a sternocostal head. Okay, this is a very huge muscle. It forms almost the entire bulk of the pectoral region. Okay, so let us start and look at the origin. Origin is always the fixed point of the muscle. So the origin of a muscle mostly never moves. It is the insertion which always moves. So the origin of pectoralis major, it has 3 points of origin. The first one is the clavicle, specifically the anterior surface. The second point of origin is the sternum, the lateral border to be specific. Also, a few fibers take origin from the costochondral junction. The costochondral junction refers to the junction between the ribs and the costal cartilages. The third point of origin is the rectus sheath. The rectus sheath is the deep fascia that covers the rectus abdominis muscle, which is one of the muscles in the anterior abdominal wall. A few fibers of the pectoralis major takes origin from the rectus sheath as well. All right, so that completes the origin. Now, coming to the insertion. Now, the pectoralis major inserts into the humerus, the proximal part to be specific. Now, where exactly in the humerus? There is something called as the bicipital groove in the humerus. The bicipital groove is a sulcus which houses the tendon of biceps. So hence it is called as the bicipital groove. So the insertion is in the lateral lip of the bicipital groove. Now, there is one special point of interest that you need to note here. The tendon of pectoralis major that inserts into the bicipital groove, it is called as a bilaminar tendon. Because as we saw, it has two heads, the clavicular head and the sternocostal head, right? So the clavicular head has a single tendon and the sternocostal head has a separate tendon, and it inserts as a U-shaped attachment into the bicipital groove of the humerus. Now, once we have done with the origin and insertion, let us see the nerve supply, action, and the clinical anatomy of pectoralis major. The nerve supply is pretty simple. Since this is a muscle of the pectoral region, it is supplied by the lateral and medial pectoral nerves. Two nerves, lateral and medial pectoral nerves. Okay, so coming to the last one, the actions. As you might already know, this muscle connects the axial skeleton to the humerus, right? So it acts on the shoulder joint. So what are the actions that it has over the shoulder joint? One is it flexes, that is flexion at the shoulder joint, adduction at the shoulder joint, as well as medial rotation of the arm. So once you know the origin and insertion pretty well, you can always come out with the actions on your own, because the origin is always a fixed point, as we discussed earlier. The insertion is the one which always moves. Hence, once you know the origin and insertion, you can make up the actions on your own. A few points of clinical interest about the pectoralis major. One is the first point is, in case of carcinoma of the breast, the carcinoma might spread deeper and invade the pectoralis major muscle, in which case a radical mastectomy is undertaken where the entire muscle will be removed along with the breast tissue. So this is one of the major points of clinical interest regarding the pectoralis major muscle. So we are done with the muscle. Pectoralis minor is a pretty simple one. I don't think that you will need a lecture on that. So in the next video, we will go ahead and look at the clavipectoral fascia, which lies deep to the pectoralis major muscle. Once you reflect the muscle along its origin, you will come across the fascia, the deep fascia that covers the pectoralis minor muscle. So that is called as the clavipectoral fascia, and it has certain nerves and arteries penetrating it. So it is of surgical interest to us. So we will look at that in the next video.